Good morning. Well, first, as you probably saw in the news, our country suffered a loss. John Dingell, longtime representative, passed away, and that's sad. Certainly, he and I disagree on politics, but I give the man a great deal of credit for spending his entire life fighting for what he believes in. I wish more Americans would do that. His loss will be felt for a very, very long time, and his impact on the American landscape will probably last forever. So I hope that his family and friends get through this difficult time as smoothly as possible, and know you'll all be in my prayers. That said, one of the major things that Representative Dingell fought for, as a matter of fact, he started every session um, in Congress by introducing a bill for universal health care or some kind of health care modification. So today I want to talk a little bit about fixing healthcare. I don't think there's anybody that disagrees that it costs too much and it's screwed up. Doesn't matter whether you like the Healthcare Affordability and Accountability Act, often called Obamacare, or don't. Fact is, it's screwed up. I'm going to tell you why, and I'm going to tell you how to fix it. The problem is it's so stupid simple, they'll never do it. So I'm pretty sure that pretty much all of you have auto insurance. And with your auto insurance, assuming you have collision, you have a deductible. Mine happens to be $500. So in the unlikely event, if I get in an accident or somebody hits my vehicle and I take it to the collision shop, they're going to contact my insurance company. My insurance company will say, we'll pay X dollars for the repair, but the first $500, they'll approve an amount. The first $500 comes from me. So when I go to pick up my car, I got to pay $500 before they'll give me my keys. Healthcare is similar in a dissimilar way. Most people that have healthcare, whether it was purchased for them by their employer and they're paying for it out of each paycheck, or they purchased it themselves, it has a deductible just like your auto insurance, and it also has a copay. The copay is consistent no matter what. Typical copay is 20%. Like in my case, I go to the doctor twice a year, and the cost of visit is out of pocket to me about $35, and my insurance company picks up about $90 of each of those visits. It's a well visit. Don't get excited, I'm not dying. Anyway, but this deductible thing. So copay is pretty consistent, even if you have Medicare. Copay is 20%, no matter what you get. Deductible. If I call up my homeowner's insurance and I say, you know what, I want to raise my deductible to lower my premium, let's say $25,000. That's what I want my deductible to be. Well, they might do me the courtesy of laughing at me before they hang up on me. And the reason that they won't let me set a deductible of $25,000 on my home is because there's an asset attached to that policy. And they know that if I've got to pay the first $25,000 of any repair or damage that's caused by a storm or whatever, probably not going to fix it, which is going to depreciate the asset. Same thing's true with your auto. If you call them up and you say, I want a $10,000 deductible on my auto, they're going to say no. However, your healthcare insurance, they'll let you set your deductible as high as you want. And the reason they do that is it's first dollar. Just like your auto or your home, you're going to pay your entire deductible before your insurance company pays a thin dime. So using my own situation as an example, my wife and I and my kids, we have health insurance provided through an employer. We pay about $1,200 a month in premium. So you don't have to be a rocket scientist. It's a lot of money a year in premiums. 12 times 12 is $14,400. And we have a $5,000 deductible, which, by the way, was chosen by the employer, not us. That's their standard. So over the years, we've had this health insurance for a very long time. We've never met our deductible, ever. Which means every time we access healthcare, I go to the doctor, as I mentioned. Basically, what happens is while I'm at the doctor's office, I'm going to pay my $35 for the visit, my copay, which never changes, and then I'm going to get a bill for the remainder. And at the end of the day, that means I'm paying the whole freight. So what that truthfully means is I'm paying $1,200 a month, $14,400 a year for the pleasure of carrying a card that has a brand on it. That's all. Now, how do you fix it? And that it's the same for everybody. It's really simple. A couple of simple things. First, don't allow insurance companies to set a deductible beyond your ability to pay. Second, have the insurance company that negotiated the deal with either you or your employer collect their own deductible. In other words, instead of passing it off on the doctor, the hospital, or the lab to become a collection agent for the insurance company, how about the insurance company collects their own deductible? They cut the deal, which means your doctor, he sends his bill, a claim, to the insurance company for you, and he gets paid instead of getting a note called a remit statement that says, send Bob a bill for the $85. That's what's wrong. And the minute we pass a law that says those two things, deductibles will go down. Insurance companies are not going to allow you, just like your homeowners, to set a deductible beyond your ability to pay because they got to collect it. And all of a sudden, the cost of healthcare will go down because now instead of getting a percentage of what they get paid for the work they do, like most physicians, labs, and hospitals do now, they get full payment. So you could actually reduce the cost because they're actually getting more. Simple. Little piece of legislation, 2 sentences long. 1, the insurance company is responsible for collecting their own deductible amounts from their insureds. And 2, a deductible may not be set any higher than the member or beneficiary's ability to pay. You can't make $25,000 a year and have a $25,000 deductible. Do those 2 things, you'll see the cost come down dramatically. We like to blame it on the FDA. We like to blame it on the doctors and the hospitals and etc. Let's lay the blame where it sits, with the insurance company. Again, using my own case, which is typical of most Americans, if I spend $4,999 next year in healthcare, I hope I don't because that meant something went wrong, and I pay my premiums, round figures, I spent $20,000 for $4,999 worth of services. That's a problem. If you want to get really crazy, how about add, you don't get to be a non-profit if you're an insurance company and you're getting billions in profits every year, like many of them are. That'd be cool. And it would fix the problem. And it's not hard legislation. Problem is, never going to get the insurance lobby to agree to it. You're also never going to get most of the businesses and so on to agree to it because there's going to be an adjustment in premiums, I guarantee it. But your premiums should be based on your utilization. That's how it works with your car. If you don't have any tickets and you don't have any accidents, your insurance is cheaper than a guy that's got a DUI and a handful of tickets, or a guy that's got a pile of accidents, or even one. But of course, nobody really wants to talk about how to fix the problem. They just want to talk about the problem. Well, problem solved. I wonder if anybody in Washington or at the state level that love to get in front of a podium and make highfalutin remarks about healthcare should be free. Healthcare and nothing else will ever be free. It doesn't work that way. You're not going to get a doctor, a hospital, or a lab to provide their services without being paid. Free is a fake term. The only way healthcare would be universal, which is the term they like, would be if everybody paid equally, and that just isn't going to happen. Well, those are my thoughts. Good luck with it.